Hello everyone, welcome to our International Public Health webinar. And today is the 13th of April 2021, and we are meeting online across Lutruwita, Tasmania, Aboriginal land and sea and waterways. And I acknowledge with deep respect the traditional owners of this land, the Palawa people. So my name is Donna and I will be your host for today's webinar. And I'm one of the student recruitment officers at the University of Tasmania, and I'm glad to be here today. So just a little bit of housekeeping before we will start our webinar. If you have any questions or any feedback while the presentation is going on, please feel free to type into the chat box and we will address your questions once we finish the session. So once again, I welcome you all to this webinar, and we are very fortunate to have Professor Roger Hughes, our Director of Public Health Programs at the College of Health and Medicine. So Professor Roger Hughes, he has lots of hats that he's wearing at the University of Tasmania. So while he is the discipline lead of public health and health system in the School of Medicine, he is also the public health domain lead in our MBBS program and graduate research coordinator in the School of Medicine. So he's just the perfect person to talk about the public health topic today. So just to give you a little bit of information about Roger. Roger served in academic leadership posts in a number of universities in the mainland. He was also a Vice Chancellor, Pro-Vice Chancellor in Research at Bond University. And he also led the development of nutrition, dietetics, public health nutrition and public health courses at Griffith University and the University of Sunshine Coast. And in 2010, he was a national Australian Learning and Teaching Citation recipient for his leadership in teaching quality in the field of nutrition, dietetics, and public health. So since 2014, he has been the forefront of public health nutrition research globally with his practice and workforce development internationally, serving terms as Deputy Editor of the Public Health Nutrition and Secretary of the World Public Health Nutrition Association. So there we go. Over to you, Roger.
Thank you, Donna. And hello, everyone. Thanks for the opportunity to give you a bit of a background to our public health program here at the University of Tasmania. As you've heard, my background is in nutrition and public health, and I have responsibility here at the University for public health education in our Tasmanian School of Medicine. So it's a delight for me to be able to explain how our public health program works and the merits of considering the University of Tasmania as a place to train in public health. Tasmania is a very interesting and unique part of the world, and I say that not because I'm biased, but because I believe it. We are a relatively small population, remembering that public health is very much about a focus on population health and working with and in populations to prevent disease and promote health and well-being in those populations. And that's an objective that all of us around the world aspire to and need to focus on to optimise the health and welfare of our populations wherever you are in the world. In Tasmania, we're a living laboratory for public health education. We've got a relatively small population in a relatively small landmass. We're an island state, around 500,000 people, very rurally distributed as a population. Although a lot of our population lives in a small number of capital cities, we do have a dispersed population. And so the challenges for public health are shared with many of the challenges you see in different parts of the world. COVID being the most relevant and immediate challenge for us. We've had a very interesting experience from a public health point of view in Tasmania, where where because of our island state and because of our ability to close our borders, we've been able to have a fairly good control over COVID-19. But it does illustrate the importance of public health training, a very competent public health workforce, so that we can protect our populations from these sorts of public health challenges. We're also a state that quite contradictory. We're an affluent society. We're a rich population, a rich country, yet we're experiencing obesity at a rate that is unacceptable, and significantly higher than what you experience in other parts of Australia and the world. And so we need to focus on not only how we deal with infectious disease, but also how we can manage lifestyle challenges like obesity, inactive lifestyles, and inappropriate dietary consumption. So we have this double challenge, much as the same as you see the double burden of disease and challenges in public health around the world. Slightly different, but the skills that we need are fairly consistent, irrespective of where you work in the world in public health. We also have a significant challenge around health literacy, and health literacy referring to the knowledge and skills that people have to make healthy choices and live healthy lifestyles. So our Master of Public Health. Our Master of Public Health is our postgraduate program that is generally of interest to graduates of health-related undergraduate programs. Most of our students are existing doctors or dentists or physiotherapists, dietitians, already qualified health professionals, nurses, who do a Master of Public Health to upskill in disease prevention. Our emphasis of our MPH is in developing solutions, creating public health practitioners with the competencies to be solutions focused rather than just understanding the problem, but developing solutions to those problems. And so much of what our curriculum looks like is around developing that solutions focus. The core units in our MPH are, as you'd typically expect to see in a public health program, units in public health, epidemiology, biostatistics, the analytical aspects of public health work. But we also have a number of subjects, units that focus on understanding the health system, understanding systems thinking being an important way to conceptualize solutions to public health problems. We focus on the practice of public health, how you actually manage interventions in populations for public health and disease prevention, and a range of other topics like health economics and communicable disease epidemiology. And all of these units together develop the mix of competencies and that you need as a graduate to be able to work in public health, irrespective of whether it's in issues around infectious disease, whether it's issues around poverty, poor nutrition, undernutrition, overnutrition, whether it be in drug and alcohol areas, sexual health, you name it. Public health competencies enable you to intervene across all of those health challenges that you experience. Our degree has a degree of electivity. Students can elect to choose to do a public health research project as part of their training, or they can choose to do elective coursework that may align with their particular interests. And so what I wanted to do was to introduce you to some of our team, some of our academic staff. It's important not only to understand the content of your studies, but also to understand the people that you interact with in that educational process. And I wanted to give you a bit of an introduction to some of our staff. Nicola Stevens is our Associate Professor in Public Health. Her expertise and track record is in managing infectious disease outbreaks, communicable disease. Nicola's had recent experience taking a lead role in the Tasmanian response to COVID-19. She was seconded through much of last year during the disruption of COVID to help manage the state response to the COVID pandemic. In the process, she's helped identify a real need for us to develop training in infectious disease management and disease outbreaks. And as a result, she's led the development of new units in our Master of Public Health that enable students to upskill in the outbreak management and public health surveillance, which gives our students an opportunity to develop those skills, which are very relevant in this environment where infectious diseases are becoming much more of a problem, and COVID-19 being the case example at the moment. Nicola teaches units in outbreak management, public health surveillance, but also mentors students through their public health research projects. And so she's an example of one of our staff who actually has real world experience of public health practice and brings that experience to training our future public health workforce. And just to give you a summary of some of the work that she does, she leads the Graduate Certificate in Health Protection. This is a program that's embedded in our Master of Public Health program. So it's a standalone qualification, but the units that you do in this qualification can be counted towards your MPH as well. And those units are outlined on that slide there. These are all new units, all largely developed in response to COVID-19. And this is a bit of the detail about the outbreak management unit. This essentially teaches students 10 steps to work through outbreak management, very practical, very relevant to how we need to respond to outbreaks like we've experienced with COVID-19. So very topical and very relevant all around the world. Public health surveillance is a new unit. This is a unit that's been developed in response to gaps in knowledge and competency in the workforce, and very much about developing skills around how to monitor public health data, how to analyse data, and how to set up systems to ensure that we understand what's going on when we do have disease outbreaks. We have units in environmental health, obviously very important in terms of public health to have a good understanding of the impact the environment has on health of populations. So another unit that's very practical, very skills based and very relevant irrespective of where you live and work in the world. And the other final unit that I wanted to flag that Nicola's involved in is communicable disease epidemiology. Epidemiology being a very important disciplinary skill set you need in public health. And so we have a particular strength in helping students develop those competencies. Another staff member I wanted to introduce you to is Rosie Nash. Rosie's one of our academics. Rosie's a pharmacist originally. She's developed her own experience and practical track record in public health. She's a health literacy expert. She works in the space of working with communities to build health literacy in communities. Rosie brings that passion around developing health literacy to her teaching. She teaches introductory to public health units, teaches health research methods, and there's a good example of an academic that is not only teaching public health, but also practicing public health and bringing in that intersection between the practice of public health to the teaching of public health. So Rosie's leading a body of research in Tasmania. Tasmania has one of the poorest health literacy levels in the country, in Australia. It contributes to inequities in the health status achievement in populations, and so it's an area of strategic importance. And so Rosie's working with communities, building capacity, training students, working with a whole range of stakeholders in the community. And that reflects the sort of work that you need to be doing in public health, and it reflects the sort of competencies that we need to develop in students. So Rosie is a central part of our public health teaching team, and students who get taught by Rosie get first-hand experience of how to work in communities to do health promotion. And then there's me. As I said, I'm a nutritionist originally. My interest is developed in prevention, how we work with populations to build capacity to do obesity prevention and promote healthy nutrition amongst mothers and babies and vulnerable groups. Again, my background is in the practice of public health, and so what I try and bring to teaching students is that practical focus so that we're producing practitioners, not just people who can analyse public health challenges, but people who can actually solve and develop solutions to public health challenges. So that I think summarises the defining features of what we do at UTAS in terms of public health. We produce practitioners. We focus on developing practical competencies. We bring real world practice experience to our teaching and where possible, expose students to experience in that work as part of your learning. So just some FAQs. What does that stand for again, Dana? Answers and questions.
Questions for the course.
Okay, so the Master of Public Health, the entry requirements are English language scores of 6.5, IELTS, no band less than 6, 24 units to be completed. So this is generally a 2-year full-time master's. It's a comprehensive suite of study, so it's not something you can do effectively in 1 year. You need to have a volume of teaching and learning exposure to develop the competencies you need to work in public health. Our program is probably the most prescribed core unit structure of any MPH in the country. We want our graduates to be trained in every aspect of public health, just not those that you're interested in. We want graduates to be competent in infectious disease management as well as in health promotion. And we want our graduates to be employable across the world in all of the challenges that we experience in public health. And our students have the option of doing a research pathway, or they can do coursework specialisations in health protection, health promotion, or environmental health. And as I've outlined, one of the features of our course is that you're taught by academics who have practical experience of public health practice as a feature of your education. We really enjoy our international students. We as academics learn from our international students as much as they learn from us. So it's a very interactive process. International students bring a lot of dynamism to our education and our teaching, and our domestic students get a lot of benefit from interacting with international students. So international students are a very important part of the mix of public health education. Public health is a global challenge. We're producing people for practice around the world, and so we look forward to international students joining us in the future.
Okay, that ends the presentation about the public health, and we now open to your questions. But before we do that, we really need your help in shaping up our next webinar content. So I would love to hear your thoughts on our upcoming webinars. So before that, thank you so much, Roger, for that very informative session. So in order for us to shape our next upcoming webinars, we would love to hear from you as to which of these 3 topics about the architecture webinar that will be on the 18th of May, we would love to present this poll and vote as to where you think would be the most interesting topic that we will be presenting. So I'm launching this poll now, and as we welcome questions from the participants in relation to the public health webinar, feel free to type in your questions while also taking the opportunity to take part in our poll. And we really appreciate your time, and this input that you will be creating will be valuable in deciding the upcoming webinar. So thank you very much.
Thank you very much.
So I think there are a few questions in here. Roger, are you ready for some questions that we'll be discussing? And of course, everyone, we will send you a copy of the presentation And at the same time, we have recorded this video and you will be given a copy of this link. So first question, Roger, is from Amir Mir, saying, could you please let me know for admission in Master of Public Health, does the student need experience in the relevant field? Which is a really good question.
Yeah, generally entry requirements require students to have done an undergraduate degree in a health degree of some sort, but it's also useful to have some experience of the health system, irrespective of what country you work in. So some experience of working in health will assist the student get entry to the course. But the key requirement is that they have done an undergraduate degree in health of some sort, whether it be in a health profession or a relevant health discipline. So, you know, medicine, nursing, allied health background, nutrition, and so on.
Thank you. And a follow-up for that regarding admission as well is, what is the minimum academic requirements for this course?
Yeah, so the English language requirements are standard. The undergraduate qualifications are there. We don't necessarily look at the marks attained in those undergraduate degrees, but we expect students who have done a relevant undergraduate degree in health-related disciplines in order to benefit from public health training. We build on health knowledge, so it's not a degree for someone who hasn't experienced or background undergraduate training in health. It builds on existing health expertise. So it's not the sort of degree you come and do if you've done a business degree or an architecture degree. It really needs to be a health-related degree at an undergraduate level.
Thank you very much. Now, from Sachin Boy, this is in relation to internship and work experience. So it's asking what kind of support in terms of engagement with the local public authorities does the university have in order to provide student opportunities for internship or work experience post the course at the uni?
Yeah, the Master of Public Health doesn't have a requirement for an internship or a work integrated learning component. Students can elect to do a research project that's supported by academics in the university, but it's very much a research related project. So students don't necessarily get placed in work. They will work, they will do university coursework, they will do assignments and things that are practically relevant, but they don't need to do a work integrated learning placement as such.
Thank you, Roger. So I've got a question to ask while waiting for some others to send their questions. With the Master of Public Health graduates, can you please give us an example of when they finish their course, what sort of job can they apply for?
Yeah, well, public health graduates tend to, often the training is done by clinicians who are training in prevention, and so that it's often a way of diversifying their career paths into public health work. In Australia, we have public health units, so a lot of our graduates go and work in public health units and work in public health teams to promote health, to protect health, and manage disease outbreaks and so on, epidemiology and those sorts of fields. A lot of our graduates go and work in community health contexts, so working in populations, working with communities to develop solutions to lifestyle-related diseases like obesity and diabetes and heart disease, or working in programs that are designed to protect the public from infectious disease outbreaks. Most countries around the world will have designated public health units and jobs in public health, and the MPH gives students the qualifications to be eligible to compete for those jobs.
Fantastic. So with the Master of Public Health course, when they completed at the university, will they go back to their respective countries and practice?
Yeah, look, a Master of Public Health is very much an internationally recognised qualification. And so it gives students the opportunity to go back to their country of origin to work in public health, but it also gives students the opportunity to get employment in other parts of the world as well to work in public health. So it very much is an internationally recognised qualification. And that has benefits for graduates because it gives them more scope to experience work and careers in different parts of the world. And as I said earlier, public health is very much a global discipline. We need to work at a global level. We need to work collectively and collaboratively in public health. And it is very much an opportunity for students from different parts of the world to work together to promote health of populations irrespective of what part of the world they are.
Excellent, that's great to know. So with the Master of Public Health, I know that's just been recently opened up to our international students. Can you please give us an example? Do you have a data when it comes to the graduate outcome of our international students?
Yeah, we've only had one intake of students who have yet to finish, so we don't have any data yet on employment of those graduates. So it's still early days. We've opened it up to international students because we recognise that we have something to offer international students in terms of training them in public health, but also that international students bring real value to the education of students in our course because of the different experience, the different contexts. And as I said, public health is very much a global discipline, and we can learn a lot from sharing experiences in different parts of the world.
Excellent, that's great to hear. So I can see that we don't have any more questions relating to the public health. Oh, there's just one question that just popped in. Do we have any highlights of graduates, either those working in Australia or overseas? That is a really good question, Joseph.
As I said, we don't have any highlights of existing international students because they're still to graduate. Our first cohorts are still yet to complete the MPH. But in terms of our general graduates, a lot of our students go on to careers in public health work and both as practitioners and as researchers. I think the observation that I can bring is that our graduates are very diverse in their career paths. When they graduate, they have lots of opportunities, and it really opens up the options that students have in terms of developing their careers. We see a lot of our students who have trained as clinicians, either as doctors or dentists, diversifying their career outcomes because they've done the MPH, increasing their options and employability. And that's a good thing. We very much want our graduates to be practically employable, and our focus is on producing practitioners.
Excellent, that's wonderful to hear, Roger. Sunil Gurung wanted to know about the intakes or the dates of the Master of Public Health. Can you please inform us?
Yes, look, my understanding is students can apply for intakes in semester 1 and semester 2. So there's no restrictions. We have more than one intake a year. So generally we find students applying and they get offers and then they turn up when the next available semester opening is. And so it can, it's every 6 months, there's probably an intake into the MPH. So we try and make it as accessible as possible to students from around the world, acknowledging that calendars in different parts of the world are quite different. If you're in the Northern Hemisphere, many students want to start later in the year, and if you're in the Southern Hemisphere, it's a different time. So we've made it so that students can enrol in the next available intake, depending on their preferences.
Thank you, Roger. Now, given the COVID-19 pandemic and our international borders are closed, with the Master of Public Health, is it available online or is it just a face-to-face course? So students will have to come and attend their classes face-to-face?
Yeah, our MPH has always been online. We have a complete online presence in MPH, so it is an option for students who can't get into Australia to still study online. For students who are obviously in Australia, the expectations that international students are on campus. And so we run on campus as well, depending on COVID. But at the moment, our campuses are open, and so we're having on-campus sessions with our international students. But we have full online capability, and we deliver our course fully online as the default anyway. So students from overseas can participate online.
Yes. Excellent. Thanks, Roger. I've got a question from Manpreet Kaur. Said, will students be able to get a chance of any work placement during the Master of Public Health program? If so, then for how many hours it will be?
Yeah, so there's no expectation that students do a work placement. If a student does want to get some experience of work, then that's something that we can assist the student organise locally, but there's not an expectation that that's part of their degree. But if they wanted to get work experience, then that's something we can work with the student to organise. We have very close links with our public health service in Tasmania and the health system, and there's always opportunities for us to organise those sorts of experiences.
Wonderful, thank you very much. Okay, I think we don't have any more questions coming up. And is there anything else that you would like to add, Roger, apart from what we discussed?
No, I think that's it, Donna, but certainly encourage people who are interested in this course to consider UTAS as a course. As I've mentioned, our focus is very much distinctively about producing practitioners to be problem solvers. And my own experience of public health around the world is that's what we need to be producing, people who can come up with solutions, not just be aware of the problems. We actually have to work on how we solve those problems.
Wonderful. Thank you.
It's been a pleasure talking to you, and wish everyone well, irrespective of where you are in the world.
Okay. Thank you so much. Understanding that with the different time zones, we really appreciate you taking your time to attend to this session. So great work, everyone, and we look forward again to meeting you to our upcoming webinar. So that is next week, which is the pharmacy. So we look forward to seeing you then.
Yeah, thanks, Donna.